Hi, my name is Kerrigan Wafer and I'm the task manager for Team 1. I'll be talking about the necessary steps involved in the program design and implementation plan. First is our health promotion model. Our team chose the MAP-IT Health Promotion Model, which incorporates the components necessary to implement a community health program successfully, including mobilize, assess, plan, implement, and track. Mobilization includes conjoining organizations and assigning roles to each member. Assessing includes allocating resources, setting priorities, discussing determinants of health, and gathering data. Creating a plan of action provides guidance and feasibility of the objectives to be implemented within the program. The implementation phase includes monitoring performance and outcomes in order to make appropriate changes. The last component of the MAP-IT model involves tracking, which consists of evaluations and analyzing progress to determine the long-term success of the interventions. Next is our interventions and facilities. Given that the HIV incidence rate in Pulaski County is extremely high, it is crucial to educate the high-risk populations regarding prevention, testing, diagnosing, and treatment. The CDC considers the following groups to be at an increased risk for developing HIV: young adults, members of the LGBTQ community, intravenous drug users, minorities, and women of childbearing age. Next is our short-term objective. The short-term objective that is set into place is education in the form of yearly conferences to public schools within the county school districts for the 2023 academic year. The Arkansas Department of Health will partner with the Pulaski County, North Little Rock, and Little Rock school boards to solidify agendas for the upcoming year. According to the current state laws of Arkansas, sexual education is not required within the academic curriculum. Since it is not feasible to attend all high schools within the county, the committee will meet and determine which schools to hold the programs. After meeting, it was established that these conferences will be held at 4 centrally located schools during the month of February. The schools chosen were Central High, North Little Rock, Jacksonville, and Maumelle High School due to their high student enrollment among the Pulaski County school districts. These conferences will cover the topic of HIV, including prevention, protection, risk factors, and local health resources, including testing centers, and will involve games and activities to increase attention and knowledge retention. Next is our long-term objective. The long-term goal set into motion is to decrease the prevalence of HIV by 90% among Pulaski County residents by the year of 2030. There are multiple health strategies that could be implemented to reach this goal, including access to free HIV testing, utilization of a mobile health unit to provide expansion options for minorities, cost savings, and decrease ER visits. In order to increase access to services, the mobile health unit will provide free HIV testing at different cities throughout the county on various days. Free condoms will also be made accessible at local Arkansas health departments, clinics, parenthood centers, community centers, doctors' offices, and schools. Another way to meet this objective is to create a pamphlet promoting safe sex techniques that can be handed out at each location. Next, I'll be talking about each team member's roles. First is educational conferences. As mentioned previously, in the short-term objectives, educational conferences will be held during the 2022-2023 academic year. These conferences will be taught by local registered nurses and advanced practice nurses that will be recruited from the Arkansas Department of Health, along with the support from the University of Arkansas Medical Sciences College of Nursing. To ensure efficacy, a meeting will be held prior, educating nurses on age-appropriate materials and discussing needs to decrease the prevalence of HIV in Pulaski County. This meeting will be hosted by the Infectious Disease Department of the Arkansas Department of Health. Roles will be designated for each segment of this presentation, including introduction, HIV prevalence, prevention, protection, risk factors, and availability of health resources. Next is our mobile health unit. To effectively implement the long-term objectives, the Arkansas Department of Health and UAMS 12th Street Clinic will partner together to provide free monthly HIV testing via a mobile health unit. The University of Arkansas for Medical Sciences College of Nursing will perform an outreach to this organization and present the plan and goals to be achieved by utilizing their resources. Volunteer APRN students from the health department and university will be providing education to patients on the unit. UAMS nursing students will also be recruited to obtain blood samples, and oral swabs for testing, which will then be sent to the Arkansas Department of Health for further testing. Lastly is condom distribution. In addition to the local health departments, expanding accessibility of condoms to clinics, parenthood centers, community centers, doctors' offices, and schools will be beneficial in reaching the long-term goal. The Arkansas Department of Health will partner with funding organizations to allocate condoms countywide. Once specific locations are determined, volunteer UAMS nursing students will assist in condom distribution, as well as creating an informational packet outlining safe sex practices that will be readily available with free condoms. Thank you.